The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
After two of the most stressful, isolating, and difficult years in recent memory, tonight we're looking at what the party platforms sketch out for addressing mental health issues in Ontario. Then we'll find out how well Election 2022 is taking on the needs of people living with disabilities. It's Wednesday, May the 11th, and that's next on The Agenda. If there was concern before the pandemic that people were not able to access the mental health services they required, those needs have only grown over these past 2+ years. Have the politicians at Queen's Park, who are now looking for your vote, offered real policy solutions? Joining us now for their perspectives, all in Ontario's capital city, we welcome, in the downtown core, Thomas Unger, staff psychiatrist at St. Michael's Hospital and professor of psychiatry at the University of Toronto. On the Danforth, Tatum Wilson, CEO of Children's Mental Health Ontario. Camille Kenville, CEO of the Canadian Mental Health Association, Ontario Division. And Quam McKenzie, CEO of the Wellesley Institute and psychiatrist at CAMH, the Centre for Addiction and Mental Health. And as I welcome all of you to our program tonight, Sheldon, I'll ask you just to put me on camera for a second, only because we have a little explanation for why this place looks so different right now. We are turning over our set to the Leaders' Debate, which is taking place for the Ontario election next Monday. So we've been kicked out of that studio for now. And truth be told, I'm in the kitchen on the 4th floor of our 2180 Yonge Street headquarters right now, so that's the crew's done a great job to make it look like a real studio, but that's our dirty little secret. We're in the kitchen right now. Anyway, with that having been said, Thomas, I want to just remind you of something you said on this program 4 years ago during the last provincial election campaign when we were talking about the state of the mental health care system in the province of Ontario. Sheldon, if you would, the clip, please.
It's an irrational, fractured, overwhelmed, I'd call it an effing mess, if I could say that on your show.
You can say effing. I don't think you can go beyond that. Okay, an effing mess is the way you describe it.
It's chaotic, and it's under unbelievable pressure.
And here we are 4 years later, Thomas, and what are you calling it today?
So I think we've progressed from an F. I'm going to give it a better mark, give credit where it's due. During the pandemic and the overwhelmed volumes and things going on, virtual care was enabled, it was funded, so we were able to continue delivering a fair bit of care, but there's still lots of work to do. So I think I'd move the grade up to somewhere between a D and a C, a D for disorganized and dysfunctional, and a C for chaotic.
I don't think the grade you gave last time was an F. I think you said it was an effing mess. Is it no longer an effing mess?
I'd say it still is, but there's some infrastructure, organizational things that make me optimistic we'll move out of that. But I would say we're still there. Okay.
Camille Quenville, what do you say?
Well, profanity aside, I think I would say that we have a long way to go with this system. Certainly investments are much needed on the community-based mental health and addiction side. We have had chronic years of underfunding, and the pandemic really, much to Tom's point, we've had some success in virtual care, but the gaps were really very evident through the pandemic, and we have exacerbated an already deprived system, and we don't have the capacity we need moving forward.
All right. All of these issues we will explore over the next half hour and change. Quam McKenzie, your view on the state of the system today.
Well, I agree with both Camille and Thomas. We've hit a perfect storm. We've got increased need for services, we've got underfunded services, and we've got a workforce which has record amounts of burnout. And we also have to think that a lot of mental health supports are done by families, by caregivers, and by communities. And they're under strain because of the pandemic, because of climate change and things like that, but also because of the affordability crisis. So you put those all together and we're in a difficult position, and I'm really happy that all of the political parties are prioritizing mental health because we really need it.
Tatum Wilson, as far as children's mental health goes, what say you?
Well, just to follow on what Quam just said, I really do appreciate that. It appears to be on everyone's radar, right? We're talking about it a lot more than we were 4 years ago and certainly before that. But in the world of children, we know that prior to the pandemic, there was already 28,000 kids waiting on the wait list for care. And in some communities, that wait list could be up to 2.5 years. So I always just imagine, I'm a new dad, and I always imagine the idea of waiting for 2.5 years to get care for anything would be unacceptable. And we certainly wouldn't accept it across a number of other healthcare areas. So is it in crisis? I think it still is, but I'm optimistic that with the right kind of investments and the right kind of collaboration across the sector, we can improve it. But certainly right now, it's not where it needs to be.
Tatum, what grade would you be prepared to give the Progressive Conservative government over the past 4 years from what they inherited to what they've now been responsible for 4 years? So where are we at today?
I don't like grades. I think, you think about all the ways in which you could evaluate something. But again, I would say that the investments have been appreciated. We did see a 5% increase in the base for the children's, youth, and mental health sector. And so there have been some investments. The commitment to the roadmap to wellness and laying out the roadmap to wellness has been welcome, as well as the investments that are coming combined between the province and the federal government. But at this point, and even if we look at the most recent budget, again, $204 million is a good chunk of change, but we need to understand, is that ongoing funding? Is it going to deal with some of the issues that Quam has addressed in terms of health, human resources, dealing with burnout, and making sure that kids can get the access that they need, and in a timely manner? That's really the most important thing.
I preface this follow-up question to Camille with the understanding that you are all working for organizations that receive provincial funding, so I understand perhaps the reticence to bite the hand that feeds, as it were. But having said that, I am curious as to, Camille, your view on how well the government's done over the past 4 years from what it inherited to what it's responsible for now. What do you think?
Well, I think before I get to that, I just want to pick up on where Tatum was going, which is to say 10 years ago, we had a select committee on mental health. And the idea was Christine Elliott's, our Minister of Health, who at the time was in opposition. And that request went to David Kaplan, who was the late David Kaplan, who was the Liberal Minister of Health, and supported strongly by France Gélinas, who was an NDP MPP and still is. And that is really evidence of really what a nonpartisan nature this issue is, which is one of the few, I could argue, nonpartisan issues that we talk about. So there's, without question, every party is committed to mental health and addiction. I think this is a unique time we haven't seen before, and there's a lot to be celebrated. We have a very long way to go, and every party, we're going to quibble around where they're putting investments, but without question, we do have support from every party, which again is a very positive for all of us who work in this sector, and most importantly for the consumers who need it.
Right. Do you want to give the Tories a grade for their performance over the past 4 years?
Well, this is the first time we've had an Associate Minister of Mental Health and Addiction. It's the first time we've had a Centre of Excellence as part of Ontario Health. And I think lots of investments are needed in other areas, including reducing the opioid overdose pandemic, the other pandemic we're seeing. Lots of more support needed in supportive housing, but we'll continue to advocate for these issues. That's a very elegant dodge. I appreciate an elegant dodge. Most of the politicians, I worked hard on that. The politicians don't normally do it that well. Okay, I'm going to ask the four of you to get comfortable for a second, because we want to go through some of the bullet points here for the four major parties and what they have on offer as it relates to mental health in this 2022 election campaign. So with that, Sheldon, let's bring up the graphics here and get going at what the promises are. The aforementioned PCs, as outlined in the 2022 budget, say that they will commit an additional $204 million annually to mental health and addiction services. This is on top of the ongoing funding of $1.9 billion over 10 years, which is matched with federal funding totaling $3.8 billion over that 10-year period. There's also $45 million and change into programs over 3 years focusing on public safety personnel, which includes police officers, correctional employees, and emergency health services workers. On to the next party. Let's check out the NDP. They're talking about committing $1.15 billion annually to create a universal mental health care system in the province, which will bring counseling and therapy services under OHIP. And that would fund a minimum of 6 sessions for treatment as a first step, and if necessary, 12 sessions. It would provide an immediate 8% funding boost for frontline mental health and addiction agencies.
The NDP also want to reduce the wait list for children's mental health to 30 days. How about the Liberals? They're talking about investing an additional $3 billion over 4 years in mental health and addiction services. They would expand coverage and reduce wait times for OHIP-covered mental health care for those that need it, including psychotherapy. And they're talking about hiring 1,000 more mental health professionals for children to eliminate wait times. And finally, the Greens. They would expand access to mental health and addiction care under OHIP, increase mental health and addiction spending to 10% of our health care budget. The budget in the last budget for health care is $70 billion, so 10% of that, do the math, $7 billion. Reduce wait lists to 30 days or less for children's mental health services. That's the bullet points for the four major parties on mental health. And I guess I'm going to ask the four of you essentially to tell me what you like, what you think falls short. So, Quam McKenzie, get us started. What do you like about what you just heard?
I think I'm where I started, where I like the fact that people are thinking about mental health. There are things that I have some problems with. Some of the money that people are talking about is the same promises that there were 5 years ago, so you can halve the amount that is actually on the table. But my main issue with what I see is that we need a huge increase in investment if we're going to actually have world-class mental health services. And if we're not going to have a huge increase in resources, then we have to do some other things. We have to go upstream. We have to think of what we can do to decrease the number of people who need services and what we can do to boost positive mental health and psychological resilience. So we have to think of what social policies we want. Then we need to increase the capacity of families, communities, and social services and workplaces to support people who have psychological needs.
Let me just jump in on the numbers, Quam, because you're talking about significant increases in investments for mental health. The parties are all talking in terms of not millions, but billions of dollars. If that's not enough, what's enough?
So, at the moment, we spend probably about 50% of what we need to spend. So if we really wanted to meet the Mental Health Commission of Canada's target of 9 or 10%, we would really be talking over a 10-year period of something between $25 and $35 billion. That's a huge amount. And what I'm saying is if people aren't going to do that, then they need to decrease the needs, increase the capacity of community, and give primary care what they need, such as the supports they need in family practices to deal with mental health issues. And then they need to be thinking about increasing the equity, the integration, and the efficiency of mental health services. But they have to, if they're not going to increase it to the level that the Mental Health Commission say, then they have to decrease the strain on specialized mental health services.
Which basically means spending more on education, housing, social services, that kind of thing.
Yeah, and thinking when you're doing new social policy, what can I do to make this social policy improve mental health? What can I do about poverty? What can I do about the national housing strategy? It's amazing that over the pandemic, one of the biggest mental health interventions was the CERB. So we have to start thinking, if we're not going to be spending huge amounts of money, we have to be thinking differently. We have to be thinking upstream.
Interesting. Okay, Thomas Unger, your view on what you like, what you think falls short.
Yeah, what I really like, what popped out of there was the idea of 10%, because it wasn't just the numbers. My heart is warmed that everybody wants to invest in mental health and addiction system. But the 10% is really great because it kind of gets at that structural inequity or implicit bias against mental health within the healthcare system, that gap, that parity gap as a Canadian Mental Health Association talks about. I mean, in the developing world, they spend only about 1.5% of their health budgets on mental health. In Canada, it's 7%, so we're quite fortunate that way. But in the UK, as Kwam mentioned, it's about 13%. And the global disease burden for mental health is about 25%. So, and there are all kinds of information to show us in research that actually the investment pays off in terms of better productivity. So I really like that it's not just a number, that there's a percentage budget that they're allocating, because that's a structural change. It's not just money one budget and that disappears or goes elsewhere. I also like the targets for wait times, because right now mental health is not being measured structurally in terms of any quality dashboards, any performance dashboards, whether it's at hospitals or in the system. And if it's not measured, it's not noticed. We need that red light to go off, because that will get attention. It's so implicitly not thought of, or it doesn't pop out, that it doesn't get the attention it needs. So I kind of really like when, in addition to the funding, which is really promising, when they start putting those kind of targets in and quality measures. I'm on the Mental Health Commission in Canada's structural stigma, structural equity, bias research team. And those are the kind of structural changes that will address this gap. So I really like the 10% figure. I really like the 30-day wait times appearing on the promises.
Gotcha. Tatum Wilson, your view on what you liked and what you thought fell short.
I mean, well, obviously, being here on behalf of our child and youth mental health service providers, it is so great to finally see not just mental health on the radar, but the distinction about children. You know, there's an old anecdote that the mental health system is the orphan child of the health system, and that children's mental health is the orphan child of that system. So to see those components included is great. You know, a 30-day wait list, if we could get it down there, is fantastic. You know, in terms of context, for a 2.5-year wait, that's actually 900 days. So to go down to 30 is great to see.
That's what the NDP is pitching.
The NDP is pitching, for sure, and the Greens, I think you said as well. And you know, CMHO, that's one of our asks that we've asked going into this election, is for the wait time to be reduced down to 30 days. I think that some of what I would like to see more of is some of the details. So we know that there's been a focus on the education system, for example, in the last couple of years, and there have been investments made to add mental health workers in the education system. However, there's wage parity issues. You know, there's issues about being able to fund frontline services in the community, and if resources are too much directed into the education system, where they're quite good at doing assessments and even perhaps some diagnosis, if a kid needs more complicated care, they end up going to the back of the line in the community sector. So that's really an area that I would like to see more of, is an appropriate balance of investments across the different areas where kids are accessing care and diagnosis and assessments, but making sure that the community sector is well resourced to be able to meet the need as, you know, need has increased and even identification and assessments have increased.
Camille, your take.
Well, I agree with all of my colleagues, and I would just add that with respect to the infrastructure of the system, it's important to remember that we have, in the mental health and addictions world, been very far behind in terms of annual investments. So what I think the acute care takes for granted, as they should, is the ability to collect the right data, to have quality improvement processes, to have standards that everyone is abiding by. And where we fall short is having the ability to do that in the community-based system. So we've made a lot of progress over the last decade or so. We have a very long way to go. So some of the massive investment really needs to go to essentially the system itself, which is cold comfort to those who are looking for mental health and addictions care for their loved ones. But it's a much needed investment to ensure that the system improves over time.
Thomas, we saw in those platforms that both the NDP and the Greens would like to have more services for people covered under Ontario's health insurance plan. I guess a two-part question here. Number one, is that advisable? Number two, can we afford to do that?
I mean, it would be great. It's advisable. They do fund, just to be fair, there is a bounce back program where some lower acuity cognitive therapy is funded by the government through the bounce back program, but it's not under the OHIP model. It would be great to bring that in. The challenge is you also have, I don't know what the rate would be, because the private rates are probably much higher than the public rate would be. Where are all these providers? We're going to have to find them. And how do you find the demarcation point between what you fund for health and illness and when you start drifting into normal everyday unhappiness? Because we don't want to medicalize and pathologize that. It will also bankrupt us. So there's going to be some challenges when you bring it into OHIP, is what would qualify for how much, who's the gatekeeper, and how do you sort that out?
You know, I know all of you are advocates for the mental health system, but and none of you, I think, well, maybe you would like to be the Finance Minister of Ontario for a day, but I don't think any of you are about to get that job in the near future. And so I have this question. I hear lots of desire to have more money spent on mental health. I see none of the parties, or almost none of the parties, advocating ways in which more revenues will come into the Treasury in order to pay for that. Yes, some of the parties are advocating higher corporate taxes or higher taxes on those making $500,000 a year, or companies making profits in excess of $1 billion a year. But no broad-based taxes to cover off any of this. I guess, Quam, start us off on this. How are we going to raise the money that we need to put more money into the system that you all want to see?
Yeah, I think that's a great question. I think one of the issues that we have to think about is the fact that if you say, for instance, look at what I think it was the Greens or the NDP was saying, and if you look at what the Mental Health Commission is saying, they're not saying that mental health, you need to raise more money for mental health. They're saying that the percentage of health spending for mental health should be between 10 and 11%.
Okay, but let me jump in on that, Quam. If you're not proposing to spend more money on the health envelope in particular, and you want to actually take, I'm not going to say this well, but what I'm trying to get at here is if you want 10% out of $70 billion, that means that somebody else's ox is getting gored for you to do that. Does that get us any further ahead when it comes to the overall health of the province if you want 10% of a static budget?
Well, the budget, I think, when they went into, when I was working with the ministry, the budget was 54 million. The budget is now 70 million. So the budget's increasing. Billion. Sorry. That's why I'm not going to be finance minister. So the money, it goes up year on year. The question is whether you oversize the amount that goes to mental health in order to try and balance and produce a fair budget. So that's one way of doing it. Another way of doing it is looking at, say, for instance, primary care and saying, how can we better support primary care to help mental health? So you're saying we've already got the resources there. How do we repurpose those resources for mental health? We know that we've got a big resource, which is families and caregivers. How do we support those, which is a low-cost thing, to give better support?
Well, let me follow up with Camille on that. Yeah, that's a great point. I'm going to follow up with Camille on that because I guess every dollar you spend on mental health, Camille, is a dollar you probably don't have to spend building a prison, is a dollar you don't have to spend building supportive housing because people are not going to be homeless, is a dollar you don't have to spend on welfare, for example, because you'll just avoid a lot of those downstream problems. You know, based on your experience on this file, do you think politicians who set budgets get that?
Yes, I think they fundamentally understand the intellectual side of that argument, but I think they also are cognizant of a 4-year term that they're in, and I don't say that critically. What I think is more important, Steve, from my perspective on all of this, is that mental health, if we're truly thinking about it in terms of our health, overall health, is held to a different standard. And by that, I mean, would we be having this conversation if we were talking about a type of cancer care or kidney failure? If there was a need for more service in any other part of the healthcare system, would we be saying, how are we going to pay for that? I just think we'd find a way to pay for it. And for some reason, mental health is held to a different standard on occasion. The Mental Health Commission of Canada indicates that $50 billion is lost from our economy every year because people can't perform in the workplace. So this is 2% of our GDP. So this is on any other issue should be getting a whole lot more attention and a whole lot more money, clearly, and focus to find a better way forward. If we're serious about pandemic recovery, what could be better than ensuring that people are mentally healthy and mentally well and able to return to the workplace and able to ensure that they're contributing to our economy? So I think to your point about the deficit in terms of how to pay for it, I think there are dividends at the end if we get it right.
Yeah, Tatum, can I get you just maybe to pull the curtain back on maybe some of the meetings you have with political people? And do you make the argument that you wouldn't leave a broken leg untreated? How can you leave, mental health issues, a broken brain, if you will? How can you leave that untreated?
Well, I mean, absolutely, and the reality is there's a moral imperative to address these issues, but there's a real economic imperative as well, both long term and short term. So we know, for example, that 70% of adults who have mental health challenges would say that the onset of these challenges were when they were in their youth. So from a child and youth perspective, the sooner you start to address those issues in their youth, it reduces the demand on the system for people when they're adults. Now, there's lots of policy areas in which we talk about these kind of long-term savings, but even in the short term, I mean, in-year possibly kind of savings, with a 900-day wait or even a 1-year wait or even a 7-month wait for access to community-based services, it significantly increases the likelihood that a child will need to go, sadly, to the emergency room, where care, the health human resources are all much more expensive than they are in the community. So if we could get to this goal of getting down to a 30-day wait period, we'll be able to address quickly the mild and moderate cases, and we'll be able to better channel those who have more severe and more acute cases into the right kind of care that they need. So right at the outset, there's a reduction in cost for the government. So we are always trying to make that case. And trying to bring that to their attention. And really, like I said, it's a moral and economic imperative. And like Camille said, we know, with children and families, missed work, missed school, and, having to leave jobs because of the need to care for a child has an impact of $421 million a year on the Ontario economy. So there's no doubt intellectually and practically in the long term and in the short term that the right kind of investments in this can make a huge difference for all of us.
Well, maybe none of you wants to be finance minister today, but I bet, Thomas, that if I offered you the opportunity to be the health minister for a day, you, knowing the system as you do, would not only be able to get in there and say, here's the amount of money we need, you might also say, here's how we need to do X, Y, and Z differently, because the way we've got it designed right now is not taking advantage of our money, resources, people, talent, et cetera, as best as we possibly could. What would you do in that case?
Yeah, so they wouldn't have me do that because they wouldn't want to see what I would do. So you're bang on. So the money is just one portion, and there's the inequity of the percentage of mental health to physical health. So that's one thing to straighten out right off the bat. But you're right, the money's not endless. And we do ration healthcare. We have to make these ethical, moral value-based decisions on how to allocate funding as equitably and as reasonably as possible given demand. We're not using the mental health providers very well right now in Ontario. We have a small number of providers dealing with the most ill, highest acuity illness. We see it when I'm on call in a hospital. They come to the emergency room, someone's suicidal, someone has a psychotic episode or a manic, they may get hospitalized, or they need really rapid follow-up or step-down care after hospital. Well, you've got 20 or 30, I'll just talk to my profession, psychiatrists, doing all that heavy lifting, and then where do they go from there? There aren't really the ambulatory acute urgent outpatient services, that missing middle of services, the team-based, because you need a team. So what happens is the other psychiatrists, at least, usually go into solo publicly funded office practices for lower acuity because they can't function without that team. So you have this wide disorganized system, and then you have the same for all these multiple community agencies. You can't get the equivalent of a burger, fries, and cola in the mental health system all at the same place at the same time.
So how would you fix that? Follow up on that and tell us how you'd fix it if you get your fingers in there.
So I think the government's made some real gains in creating these Ontario health teams, trying to connect a continuum of service providers that follows the patient's journey, their function. So the form of service should follow the function. Right now, the form drives dysfunction. Instead of refaxing a form for each agency, so you get your doctor here, get your nurse here, you get your social worker here, you get your addiction, they all need to come together under one common governance so someone could get them working together so that they serve the patient's needs first, not their agency's mandate first. And that's what's going on. So nobody wants to do that. They all want this consensus collaborative governance model because, it doesn't ruffle feathers, but it's also not going to achieve the transformation we need to get everybody working together as a team. And that's going to take a little bit of nerve and courage. So that's what I would do.
Okay, Quam, let me ask the same question to you. If you were sort of the mechanic of this car and you could get under the hood, how would you change things? Not necessarily more money, but reorganize to make the money more effective.
Well, I do think that I agree with Thomas in many ways. I came, as you know, from the UK, and the model that Thomas is talking about, these area-based systems, were exactly how things were sorted out. So when I was sort of working in the UK, a number of local family doctors even had access to my Outlook, and they could book appointments straight in, because we worked so closely with primary care. And I did home care, but I also did hospital care. And so we're an integrated system. And the thing that really would blow a whole bunch of people's minds is that we were, our management was the same management as social services. So social services and mental health services, we're in the same umbrella, because people could see that the social determinants of health were important with, the work we were doing in mental health. And this organization of rational, as we've been talking about, evidence-based care, which is links from the community through primary care into specialist services, and also has a pathway out, which is what Thomas was talking about, is the way that you create value for money, quality, effective mental health services.
Tatum, can I get you under the hood of that car as well? How would you reorganize things to take better use of the dollars available?
Well, the point has been raised a little bit about the mental health sector in general, but also specifically in the area of children. I mean, one of the early and not easy, but well worthwhile things that we could do is focusing on better data, better understanding of who needs what services, better understanding of sort of the appropriate ratio of staffing frontline workers to community size and need and demand. So, a significant increase in the focus on data would really help us. And then also it can help us look at then what are the appropriate care pathways, what are the solutions that work, what are, as Quam has talked about, the connections that should be available to primary care, the connections to school, and sort of taking a comprehensive approach at looking at all those factors. Once we have the foundation of the data, would allow the government, or me as the Minister of Health, to make evidence-based decisions in terms of the delivery of care, which again will help us. The money will be a big part of getting down to a 30-day wait, but making sure that people are getting the right care that they need in the right place and in the right time based on their need from a patient and family perspective. And organizing that care appropriately will be one of the ways to achieve this goal.
Yeah, let me put that to you too, Camille, because in a $70 billion budget, it's impossible for me to believe that all of that money is being perfectly, appropriately spent on the right things at the right time all the time. So how do we make a system that's more effective so that the dollars go further?
I think that's a fair comment. And I think part of it is the care pathways that Tatum just referenced. So very often navigation is difficult for families. We hear this routinely. People don't know where to go. So if we talk about looking at this through the lens of a family or an individual seeking treatment or care, how do we assist them in getting to the very best care? So in some cases, if it's a child in a school, how are we connecting to that community-based child and youth mental health provider? How is primary care connected to community? One might think these are easy issues to solve. Unfortunately, they're not. We've been at it for some time. So are there better ways forward for us? Absolutely. Outside of a funding envelope, I think we have done a lot of work there, and certainly more can be done. But there are some investments needed, unfortunately, and I do go back to the infrastructure and the system, the data collection and the quality improvement processes that need to be embedded.
All right, we've just got a few minutes left here, and I guess under the title of necessity being the mother of invention, we seem to have, in a way, stumbled into a new potential solution for some of the issues that we've been talking about, namely telehealth and virtual care. And Thomas, I wonder if you could tell us, I know this has always been a bit of an issue between the government and the Ontario Medical Association in the past, but there now seems to be a consensus that this is a real permanent way forward for mental health treatment. Do you see it that way?
Absolutely. The genie's out of the bottle. I mean, to the credit of the government, very quickly they pivoted and allowed OHIP funding for virtual care, telephone care, or one of the various video platforms. And it's been great. It really allowed us to continue to providing care. And I can do most of what I do, not all, but most, over this and it saves people money. They don't have to take a half a day or day off work to travel and pay parking fees and everything. So I think it's fantastic, but it's amazing that we have that innovative capacity. We have smart providers, smart people in Ontario. They're world class in some case. And it took that to get us to shift and transform the system into something that we all kind of knew would work. So to their credit, we did it. We have a bunch of other things we can do that way, but there's been resistance to change, fossilized between institutions. So this is going. It's also going in the private world significantly with competition. Employee assistance programs are doing it. So I think it's been just one great example of a positive that's come out of this pandemic and the need for the huge crisis we faced.
Tatum, does it work well for kids?
It's a bit of a mixed bag, right? So, part of the notion of getting effective intervention therapies with children is you have to build rapport, you have to build trust. And in a world where you're doing this virtually, recognizing that a lot of kids have been going to school virtually, but in the area of mental health care, that can be a challenge. Is it one option in the tool bag? Of course, toolbox. Yes, it is. It is for sure to do virtual care. But I think specifically in the space of children and youth, we need to really be looking at sort of can they access care in a physical location, and then how does virtual care complement that, as opposed to being the overall solution for all of the access problems that we know that we have.
Quam, what's your view on that?
Well, you're preaching to the converted. Most of my clinical care has been virtual for about 4 or 5 years. And I think there are many things that you can do with virtual care, but I do think that having a really, really good digital strategy that deals with the inequities that we have in the digital space and makes sure that we've got proper processes like Tatum was talking about to make sure we're doing effective digital care is, I think, where we need to go. Because over the pandemic, we have actually, it's not just digital, we've got this big growth in the third sector mental health care. We've got big growth in more culturally appropriate and equitable mental health care. And we've got cities starting to get involved in mental health care. And we haven't even talked about youth hubs. So there's loads of things that are happening that are really good that we can build on. We have effective care. And actually, I don't think our care is that much less efficient than anyone else. And I think just like Camille said, we're being held to a higher standard. Okay, so be it. But we're passing that every day. So give us more resources so that we can deliver better mental health. It's possible if we're given the support that we deserve from showing our delivery.
Well, that leads me, I guess, dovetailing nicely into my last question for Camille, which is, as the budgets go up, do we, even in the province of Ontario, do we have enough psychiatrists? Do we have enough psychologists? Do we have enough mental health professionals to do all the work that's needed and or able to be funded?
No, we don't. Just on the virtual care, I'll just quickly say the Canadian Mental Health Association runs Bounce Back, has been running it for 10 years. It's telephone-based coaching, bounceback.ca. In terms of your question on health human resources, no, we absolutely do not have enough. The community sector in particular continues to bleed their staff to higher paying jobs in school boards and hospitals, which is understandable. I think Bill 124 is very problematic for us in that regard in terms of retaining highly valued staff who, by the way, have worked exceptionally hard in the last 2 years. And a study by Canada Life indicates that after nurses, mental health and addiction staff are the second most burned out. So not only are we lacking the resources we need, the resources we do have have really been through a lot and are struggling. So when we talk about base budget increases and infrastructure in the system, we have to shore up how we are treating these individuals to make sure we have a healthy, robust system to give clients and families the care that they deserve.
I want to thank you for coming on to TVO tonight and sharing your views on such an important subject. Camille Quenneville from the Canadian Mental Health Association, Thomas Unger at St. Mike's Hospital in U of T, Tatum Wilson, Children's Mental Health Ontario, Quam McKenzie, Wellesley Institute, and CAMH. Great to have you all aboard our program tonight. Many thanks.
Thanks very much.
Thank you, Steve.
Thank you.
The goal set in 2005, when the Accessibility for Ontarians with Disabilities Act came into effect, was that by 2025, this province would be fully accessible. That date likely falls in the range of the next government's term in office. Is this election dealing with that? Well, the person to ask is David Lapovsky, chair of the Accessibility for Ontarians with Disabilities Act Alliance, and he joins us now from the provincial capital. And David, it's always good to have you on our program. I wonder, you know, it's a temptation to say that this election is always the most important in history, and sometimes it's true, but sometimes it's not. So I want to get a sense from you off the top, in terms of the issues affecting people with disabilities and the deadline that looms 3 years down the road, how important is this election?
For over 2.6 million people with disabilities, and for all the rest of your viewers who are bound to get a disability at some point in their life, this is, in fact, the most important election in 2 decades. And the reason is this. Back in 2005, as you mentioned, the Accessibility for Ontarians with Disabilities Act was unanimously passed. In fact, that was 17 years ago yesterday. And it was a very exciting day, especially for those of us who fought for a decade to get that law passed. It required our government to lead the province to become fully accessible by 2025. Every election since then, we've been making requests to speed things up, make some adjustments, keep us on track, and so on. But now we are at the, frankly, deeply upsetting point where it is now clear beyond any doubt that we will not reach that goal in 2025. And so we need the next party, whoever forms the government, to make strong commitments for Plan B. What are you going to do because we failed to meet this goal? How are you going to get us as close to that goal by 2025 as possible? And how are you going to get us the rest of the way as soon as possible after 2025?
Liberals and Tories have both been in power from the time that this bill was passed to today. Is there one you hold more in contempt than the other for the fact that we are where we are?
Well, we're nonpartisan, so we just take a look at what everybody has done. And I think the Liberals get credit back in 2003 for committing us to this legislation and for doing a good job of developing it and passing it and getting unanimous consent for it. However, at the start, their implementation was good, but gradually it started grinding slower and slower and slower. But in contrast, since 2018, the Ford government bears significant responsibility because they kept saying, we're going to do better than the previous governments on so many issues. On this one, it was hard to do, but they did much worse.
And just so we're all clear, when you say that the bill commits Ontario to being, quote unquote, accessible to all by 2025, give us some examples of what that means.
Well, when we say accessibility, that makes you think of buildings. And of course, that's an important thing. And that's why we were given this long. But it also means that 1/3 students with disabilities can fully participate in our schools, and hundreds of thousands more can fully participate in our post-secondary education system. It means that patients with disabilities, who disproportionately are the users of our healthcare system, can get full and equal access to our healthcare services. It means that those of us who have a disability, I happen to be blind, that we can make full and equal use of our public transit services. And it means that for people with disabilities who've always faced extraordinarily high unemployment rates, the pursuit of competitive employment based on your individual ability would be a reality for them as much as it is for everybody else.
You know, it's interesting, David, that 4 initials have been mentioned quite frequently during the course of this election campaign, and those initials are ODSP, the Ontario Disability Support Program, which all 4 parties have had a lot to say about. Are you prepared at this stage to weigh in and say which party you think has the best disability support program plans in their agenda?
Well, we don't advocate for or against any party. It is very significant that for people with disabilities, are that people with disabilities disproportionately live at or below the poverty line. And therefore, disability-targeted social assistance is very important, both to be able to live independently and to be able to overcome poverty. Our ODSP rates have been forcing these folks to languish below poverty for far too long. And over the past, since the fall of 2018, those rates have not been increased. A single person living alone with a disability who's on ODSP has to live on about, I think it's $1,169, and that covers food, shelter, everything. So the parties, the three opposition parties, committed to raise those rates. And it was only, I guess, yesterday or the day before that the Conservative Party got religion and has itself committed to raise them, not as high as the opposition parties, but it has for the first time. What does that tell us, Steve? It tells us that elections are the chance for us to get to politicians who have been recalcitrant on an issue, who've had the chance to make things better and didn't, and to try to press them to do so. And that's exactly what we're doing during this election on the issue of accessibility for people with disabilities.
Well, you point out the Progressive Conservative Party did offer to raise the rates by 5% a year, which in a 6 or 7 or 8% inflation world is still falling behind. And I think the Greens are on record as having said that they would double the rates were they in a position of influence. So we've got quite a gap there of promises on the record. What do you think would be a reasonable amount to raise the disability support payment rate to?
I think the first thing we do is look at the poverty line and saying people who have to rely on ODSP should not have to live below the poverty line. That's the starting point. And then we work up from there. But this is what's significant about this is that we have excellent community advocates pushing and advocating on the ODSP and poverty issue. This is a big success for them, but it only came in the election campaign itself. I'm very actively involved in campaigning on making Ontario accessible for people with disabilities. Now, they're not silos. Accessibility without a livable income is not going to get you very far, and a livable income, but where you can't go anywhere or benefit from much, is similarly not sufficient. What's significant in this election is that on the issue on which I've been involved is last November, we came to the deeply upsetting conclusion that Ontario is so far behind on accessibility that it will be impossible to meet the goal of full accessibility by 2025. So we wrote all the political party leaders and mapped out an agenda, a series of requests that we need commitments on to get us as close to that goal as possible, and then to get us the rest of the way after 2025. All three of the opposition parties, the Liberals, the NDP, and the Greens, have answered. Doug Ford has refused to answer. He has refused to even respond. This is the first time the Conservative Party in almost 2 decades during an election has refused to even respond to a request for commitments on this issue. And we think that people with disabilities, over 1 million voters with disabilities, deserve better.
Well, don't take it personally. The PC party, as a matter of faith, is just not responding to any of those kinds of surveys or outreaches. We've had other groups say the same thing on this program. But I want to do one more thing on the ODSP, and that is perspective. I know that even 20 years after he left office, Mike Harris is still a name that will cause a lot of people to start an argument all these years later. And Mike Moffat, the economist, who's an occasional guest on this program, has pointed out that even with the commitments the Progressive Conservative, Liberal, and New Democratic parties are making in this election campaign, where you end up after their increases kick in, adjusted for inflation, the ODSP rates are still below what Mike Harris was offering people on disability support more than 20 years ago. Only the Greens are offering something that would better that. In terms of perspective, how important do you think it is that we know that?
I think it's really helpful to know that. I think it's also helpful in that context to know that When Mike Harris was campaigning to cut welfare, he said, except for people with disabilities. Even he, whose agenda on social assistance was how, shall we say, controversial, was prepared to acknowledge that we shouldn't make things worse for people with disabilities. And I have had members of his government talk to me after they left power, because their record on accessibility was pretty bad, and come to me and say that on the issue that in which I'm involved, they've said, why didn't we do better? That's them asking me, why didn't they do better on our issue? So it's important as we look back that we learn the lessons of their mistakes.
Okay, more broadly based, as you approach the campaigns, the various campaigns for commitments you would like to see them fulfill during this election campaign, what's at the top of your list?
Well, we start from the point of view that we've lost a lot of ground, especially over the past 4 years. The new normal where we live is actually worse for people with disabilities than it was 4 years ago. It is more dangerous to go to school for students with disabilities. It is more dangerous to go to try to seek out the healthcare system for patients with disabilities. It's even more dangerous to go shopping as a person with a disability if you're immune compromised now, because they don't require masks there. And yet we didn't make any material progress over the past 4 years on accessibility under the Disabilities Act. No new accessibility standards were enacted. Not a single existing one was strengthened. There was no significant improvement to weak enforcement. And the government spent a whole lot of our money on new infrastructure projects, new public transit, new hospitals, and new schools without ensuring that they would be accessible. And if you don't plan for accessibility, it does not happen. So what we've said to all the parties is, first, we need the premier, whoever it is, and we're prepared to work with any of them, to begin on day one by showing strong leadership. We need them to make it clear that this is a premier's issue. The current premier has not even met with us. That's the first premier in almost 2 decades who's refused to. But that's fine. Let him change his mind now. We'd be happy to do so. We need them to come about and do a major review of the education system, because there are far too many barriers facing students with disabilities. We need them to review the healthcare system. As I said, there's just too many barriers. For example, the current government allowed a critical care triage protocol to be embedded into the DNA of our healthcare system, which legitimizes discrimination against patients with disabilities, a deeply troubling measure that we need rooted out. There's no critical care triage going on now, but the vestiges of that as an acceptable practice remain and must be abolished. So those are the kinds of things that we're asking for, things that will help everyone who's watching the show, because everyone watching the show either has a disability now or is bound to get one later in life.
I note that one of the asks that you have is that you would like the 4 major parties to consider creating a minister responsible for disabilities. And I wonder why you think, let me put it this way, I wonder why you think that would move the yardsticks forward, in as much as sometimes I've found over the years that if you give a senior cabinet minister additional responsibilities they've got more schlep at the cabinet table than, say, a junior minister who may have a standalone ministry but no schlep at the cabinet table. You know what I'm saying?
Okay, this is where Paikin and Lapovsky are in kind of a political techno land. It's really important, even though some people out there watching might think it's kind of very inside baseball. By the way, sorry your Red Sox are doing so badly. But the actually, no, you're not.
No, you're not.
It helps. No, you're right. I'm not. The fact is, we've had experience with both. What happens when you have a senior minister who's also the Minister of Community and Social Services or Economic Development is they never look at this file. They get no time. And then you're buried in a public service that can't even look at it. We need a standalone minister whose sole job, whose 24 hours a day is dedicated to moving things forward. And frankly, get us a junior minister, get us a new member of cabinet who's hungry and eager to move up the ladder. Let them want to make some successes and score some wins.
Okay, interesting. Fair point of view. David, I want to circle back to something you said about the public transit building that's going on right now. And there's a lot of it, billions and billions of dollars of new subway lines, LRTs, and so on and so forth. Now, you've said that they haven't taken into account yet in their designs accessibility for disabled people. Is that to say this stuff will be built without that in mind, or that it's not too late to fix this?
Well, it's never too late to avoid more mistakes, but we know from infrastructure, from new education buildings, new hospitals, new public transit, that every time the government pours money into it, without attaching accessibility strings beyond our weak and inadequate building code, a building code this government never fixed, every time they do that, you end up with new barriers. This is just as predictable as the day is long. And so that's why we've said one of the requests, this is what's so jaw-dropping about the fact that the Premier won't even answer us. One of our requests of the parties is, will you commit that you won't use public money to create any new barriers? I mean, that's just basically being responsible with the public purse. And Doug Ford, one of his branding is he wants to say he's responsible with the public purse. The other parties responded to requests for commitments on this. Doug Ford so far hasn't. Now, it's not too late. Our goal in this election, we're nonpartisan, is not to support any party or oppose any party. Our goal is to get commitments from all the parties. So we call on Doug Ford to meet or beat the platforms of the opposition parties. They've all made a series of helpful commitments. Doug Ford could do so too.
And we just say that if people want more information on this, they can go to your website for the Accessibility for Ontario Disabilities Alliance with Disabilities Act Alliance. And you've got an all-candidates debate coming up on May 17th at 7:30 in the evening, so people can watch that and learn more. David, thank you for coming on our program tonight. It's always good to see you.
Thanks very much for covering this topic.
And that is the agenda for Wednesday, May the 11th, 2022. Ontario has made certain commitments on the climate file, and tomorrow we'll assess whether the parties have put forward ideas this election cycle to meet those promises. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.